Hi, everybody. We're going to continue our discussion on medications that affect the central nervous system and specifically talk about meds that treat anxiety and sleep disorders as well as seizures. Anxiety is a condition that occurs in response to a perceived threat. It's been described as a, quote, sense of dread or fear, end quote. The sense of dread can arise from past experiences, imaginary experiences, or daily occurrences. Anxiety has not only psychological effects, but physiological effects as well. The physiological effects are similar to those of a sympathetic nervous system response: elevated vital signs, dry mouth, sweating. Anxiety can also cause a disruption in sleep. Anxiety can be a symptom of disorders such as depression, or it can accompany a physical illness. There are also specific psychiatric disorders characterized by higher levels of anxiety, such as obsessive compulsive disorder, which involve reoccurring thoughts and repetitive behaviors, post-traumatic stress disorder, where clients experience anxiety because they relive a stressful event, or generalized anxiety disorder. The source of the fear and dread is kind of difficult to identify. All of us experience anxiety at some time or another. Our response to the anxiety varies. If we've developed effective coping mechanisms, we can adapt and adjust. If the anxiety becomes overwhelming and interferes with daily functioning, psychotherapy and pharmacotherapy is indicated. The part of the brain called the amygdala recognizes this fearful stimulus. The amygdala is part of the limbic system, that structure that controls emotions, behavior, and memory. A signal is sent from the amygdala to the hypothalamus, which will initiate that fight or flight response that results in the elevated heart rate, blood pressure, and other changes associated with sympathetic nervous system activity. There's another structure of the brain associated with anxiety, and that is the reticular formation part of the reticular activation system, or the RAS. This part of the brain regulates the signals that are sent to the cerebral cortex. It regulates sleep, wakefulness, and the ability to respond to stimulus. When the RAS is overstimulated, an elevated sense of arousal and alertness, or anxiety, occurs. If these signals from the RAS to the cortex are blocked, feelings of relaxation, drowsiness, and sleep occur. So there is a connection between anxiety and insomnia. Both are caused by the excitatory transmissions between the RAS and cerebral cortex. It's hard to say what came first. Is anxiety causing the insomnia, or is the insomnia causing anxiety? We are certain that they lead to a vicious cycle. So therapies are based on treating anxiety during the wake hours and treating the insomnia at night. We'll talk about the medications that are used, but first, let's review the topic of sleep. As mentioned before, sleep and wakefulness are regulated by the reticular activation system, the RAS. So If we can block those excitatory transmissions from the RAS to the cerebral cortex, we can induce sleep as well as reduce anxiety. Sleep is essential to our well-being. It's a period of altered consciousness that allows the body to physically and psychologically repair and restore. New cells are generated, and psychological processes such as memory and problem solving occur. Sleep involves cycles with several stages that you covered in Nursing 1. Sleep induction, non-rapid eye movement sleep, then rapid eye movement sleep. A reduction in acetylcholine leads to non-rapid eye movement sleep, where vital signs lower. These stages are necessary for physical repair and regeneration. Slow response time, apathy, and fatigue can occur with sleep deficiencies that affect non-REM sleep. Rapid eye movement sleep is associated with psychological well-being. Vital signs become irregular, eye movement increases, and dreaming may occur. REM deficiencies can result in psychological manifestations like irritability and mood changes. As one author put it, with a lack of REM sleep, we all become tall 2-year-olds. There are over-the-counter products that can be used for anxiety and sleep. Although they might have their benefits, they also carry the risk of adverse effects. Antihistamines are primarily used to treat allergic symptoms due to histamine release, such as seasonal allergies. This class of medication has an antagonistic effect on histamine receptors, specifically H2 receptors, in the upper respiratory system. And so they help to prevent the watery eyes and runny nose that accompany an allergic response. Diphenhydramine, a widely used antihistamine, crosses the blood-brain barrier. When blocking H2 receptors in the central nervous system, a mildly sedative effect is achieved. Antihistamines, like diphenhydramine, can have anticholinergic effects. They block the effects of acetylcholine by binding to muscarinic receptor sites in the parasympathetic nervous system. Some muscarinic receptors are located in several organ systems in the body, so there can be a wide variety of anticholinergic effects, such as dry mouth, blurred vision, constipation, and urinary retention. Diphenhydramine has a long duration of action, so another adverse effect is that of a hangover, where the sedative effects extend into the next day. Natural products are also used for sleep therapy. Melatonin improves sleep onset, but can cause headache and mental impairment. Valerian has also been found to help promote drowsiness. Benzodiazepines, or as they are commonly called, benzos, have several indications for use. Benzos bind to a neurotransmitter called gamma aminobutyric acid, or GABA, and helps to increase its effect. GABA has an inhibitory effect on CNS function. Since benzos increase this inhibitory effect, they are indicated for use in sleep disorders, anxiety, seizure disorders, alcohol withdrawal, and they are used as a preoperative medication. Benzodiazepines are sedative hypnotics. At low doses, they induce a relaxed state, what we call sedation. At higher doses, they have a hypnotic effect and induce sleep. Benzos vary in their onset and duration. Alprazolam, or Xanax, when given PO, is well absorbed and has an onset of about 1 hour. Its duration is about 2 hours, so it can be used to induce sleep. Xanax is also used to treat generalized anxiety disorder. Lorazepam, or Ativan, and chlordiazepoxide, Librium, are longer acting and are often used to prevent the adrenergic surge, those elevated vital signs and agitation that occur with alcohol withdrawal. Side effects of benzos will mostly affect the central nervous system. This would include side effects such as dizziness, drowsiness, and lethargy. Those would be the most common. The hangover effect that I mentioned before is less common, but sometimes happens. Gastric motility can slow down, so encouraging hydration or high fiber foods can help to offset that adverse effect. When used to treat sleep disorders, doctors recommend short-term use since there is an increased risk for tolerance and dependency. Clients should also avoid using other CNS depressants while taking benzos, since this increases the chances of hypotension or respiratory depression. A note: benzodiazepine overdose rarely results in death unless taken along with other CNS depressants. And those other CNS depressants would include alcohol, opioids, and muscle relaxants. Overdose is treated with flumazenil, which has an antagonistic effect at receptor sites. Other points: take the medications as directed. Do not double up if a dose is missed. Do not stop abruptly. The dose is tapered to prevent withdrawal symptoms. Finally, encourage behaviors to promote sleep and reduce anxiety. Sleep hygiene practices would include darkening the room, using relaxing music, drinking some warm milk. Stress reduction techniques would include guided imagery, deep breathing, and positive self-talk. Other meds used to treat anxiety would include antidepressants. Antidepressants are a class of medication originally developed to treat mood disorders. They are now indicated for treatment of anxiety disorders as well. When we discuss antidepressants in another lecture, I'll talk about them in greater detail, but let's briefly discuss them here. For clients that experience fearful responses to memories or situations, there is often a two-step process where they first begin to anticipate the fearful stimulus. Next, the client experiences the physical symptoms like elevated heart rate, shortness of breath, palpitations. Antidepressants are thought to work by reducing those negative thoughts that occur when the person first anticipates the feelings of dread. This occurs due to increased supply of serotonin, a neurotransmitter thought to improve mood. Antidepressants can also suppress autonomic nervous system functioning and thereby reduce the stress response. And this reduces the physical symptoms. Zolpidem, the brand name is Ambien, promotes non-REM sleep. Like the benzos, it potentiates GABA functioning. And like the benzos, it does have a potential for tolerance and dependency. It is used for short-term treatment, no more than 10 days. Zolpidem has a very quick onset, about 10 to 25 minutes. Advise your client to take it at bedtime. Adverse effects include dizziness, headache, nausea, and vomiting. Neuropsychiatric reactions have sometimes occurred, such as sleepwalking and hallucinations. Amnesia and suicidal thoughts can also occur. Just like the benzodiazepines, concurrent use with other CNS depressants should be avoided. Now, the next topic of discussion would be seizures. I'd like you to watch the following video. Write down a list of the symptoms that are described or that you observe, and we will list them on the next slide.
Seizures can be caused by many things like stroke, a really high fever, or low blood sugar. And sometimes, though, the cause is unknown. Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, is back. We're going to talk a little bit about seizures and what to do if you witness them.
So let's talk about what a seizure really is. If you think about our brain function, all of our brain function depends on our nerve cells talking to each other through chemical and electrical activity. If there's a surge in that activity or a break in it, that's a seizure. And if you have two seizures for unknown causes, then that is a disorder we call epilepsy.
This is important to talk about because there are different types of seizures. In a partial seizure, you may see uncontrolled movements, but they may progress to what you're seeing here, a generalized seizure involving essentially all body parts. They typically do last no more than a minute or two. But another type of seizure entirely is called the absence seizure. It's most often seen in children, and its symptoms are very different. Joanne and her 7-year-old son, Julian, are here with us today. Julian has absence seizures, and what has your son's experience been with these?
He started having these episodes where he would take a deep breath, he would blank out, and it was like pressing pause on a DVD player. He was out, his body would freeze for 5 to 10 seconds, and then he would come back and have no memory that any time had passed by. And he was having them at least 15 times a day.
Let's take a look at this video. It's of another child having an absence seizure.
Tyler.
Now, first of all, hi, Julian. How are you?
Hi.
Good. I have a question for Mom. So is this similar to the experiences that Julian was having?
His were a little more dramatic. We thought he was having hearing problems at first because we kept calling his name and he wasn't reacting to us. And his teacher thought maybe he has ADD, he's not paying attention, he's not taking direction. And he also started stuttering because he was having these seizures so frequently that he would be in the middle of a sentence and he would lose his train of thought and start saying, And we didn't know that he was actually having seizures.
And we talk about that idea of the blank stare, and sometimes children with these absence seizures, they are wrongly thought to have attention deficit hyperactivity disorder because they do. They look like they're daydreaming, looking past you and ignoring you.
How did you find out that Julian was having seizures?
Well, we went to the pediatrician for a checkup, and I asked the pediatrician, I said, he's exhibiting these behaviors. We don't know what's going on. And during the exam, he had a seizure right in front of the pediatrician. I said, that's it, that's what he does. And the pediatrician immediately said, oh, he's having an absence seizure. And within 3 weeks, he was on medication, and 4 days into the medication, he completely stopped having seizures.
Well, that is such good news. Joanne, thank you so much for sharing your story. Julian, thanks so much for being here, bud.
If you see someone having a generalized seizure like the one that we saw in the earlier video, here's what you should do. Make sure that you stay there for the full duration of the seizure. Stay there till the end. Ease the person to the ground so that they don't fall, and make sure that everything is loose around their necks. And make sure, if you can, that you turn the person on their side so that you keep their airway open.
And there are definitely some don'ts. Don't stop their movements. Don't force anything into their mouth or try to hold the tongue down. This can be very dangerous.
Absolutely. And if you have a seizure, make sure that you call your doctor and tell your doctor what has happened. And for more information on seizures, go to gethealthystayhealthy.com.
And you can also visit thedoctorstv.com. And remember, consult your healthcare provider with any concerns when it comes to your health. Thank you so much.
Thank you.
Coming up, we're sharing information everyone must hear to have a healthy and safe weekend. We're also going to see the results of the new facial filler procedure. Stay with us.
All right, so let's see what those excellent assessment skills of yours came up with. Now, in the short video within the video, you observed a woman having what looks like a grand mal seizure, a generalized seizure, with intense muscle contractions. So, involuntary movements like twitching, shaking, or tremors can occur. There is also a loss of consciousness. It could be a loss of consciousness where a person completely passes out, a complete loss of consciousness, or the person can just stare into space and appear to be daydreaming. Other symptoms can occur, like altered vision, difficulty speaking. The seizure might start with an aura that warns the client of the seizure. The client can also experience amnesia and fainting. Now, the symptoms vary based on the type of seizure, and all of these are listed in your Adams text on page 151. Now, when more than one seizure occurs, when there are recurring seizures, the client receives the diagnosis of epilepsy. The provider will look at the presenting symptoms as well as an EEG. During seizure activity, the EEG will show a disruption of the usual electrical activity in the brain. In short, the electrical activity becomes intermittent, excessive, or disorderly, and that results in the symptoms that you observed in the earlier video. Seizures occur because of an underlying disorder. The cause could be trauma, such as a physical or chemical injury to the brain, could result from high fevers. This most commonly happens in the very young. Metabolic disorders can cause seizures, such as glucose and sodium imbalances. Also, infections that affect the CNS or can cause seizures, as well as brain cancers. Now, as far as the pharmacotherapy, anti-seizure meds, also called anti-epileptics, are used in the treatment of epilepsy. The provider will begin with a low dose of one medication and then increase the amount until seizure activity is controlled. If the dose of the single medication becomes too high and either side effects become intolerable or toxic levels have been reached, a second medication will be added. The second anti-seizure medication will be started at a low dose and then increased, while the dosage of the first medication will be decreased. Eventually, the right balance of the two meds will happen when toxic and side effects subside and seizure management occurs. Anti-seizure meds suppress CNS activity by altering the movement of electrolytes across the neuron's membrane. Movement of chloride ions across the neuron's membrane suppresses the electrical activity. and helps our old friend GABA to reduce excitability. Some anti-seizure meds help the movement of chloride ions. Other meds inhibit the movement or influx of sodium and calcium across the neuron. These electrolytes, sodium and calcium, enhance the firing of neurons. Phenobarbital is commonly used anti-epileptic, and it is a barbiturate. It increases the inhibitory effects of GABA on the CNS. It is a Schedule IV controlled substance, so it does have a potential for dependency. Phenobarbital is inexpensive, has a long duration of action, about 12 to 16 hours when given PO. Adverse effects will include drowsiness, but vitamin deficiencies too. Vitamin B9, B12, and D deficiencies have been known to happen. Laryngospasm can occur as well. Now, care should be taken when given IM because a localized inflammation can occur. When given IV, assess for extravasation, since phenobarbital can cause tissue necrosis, tissue death. There is no antidote for phenobarbital. With overdose, gastric lavage, or hemodialysis would be indicated. If respiratory depression occurs, mechanical ventilation will be needed. Now, dilantin, a hydantin, temporarily suppresses the movement of sodium across nerve membranes. It may take about 7 to 10 days for a full effect. Careful monitoring of lab values is needed since there is such a narrow therapeutic range, about 5 to 10 milligrams per deciliter. Gingival hyperplasia, or overgrowth of the gums, is possible, so good oral care and more frequent visits to the dentist are necessary. Because dilantin temporarily suppresses the movement of sodium ions, it can also affect cardiac conduction, which also depends on the movement of sodium ions. As a result, dysrhythmias and bradycardia are possible adverse effects. Phenytoin-like anti-seizure meds would include valproic acid and carbamazepine, or Tegretol. Valproic acid has several brand names that differ: Depakine, Depakon, and Depakote. They have different pharmacokinetic patterns. For the most part, these meds are given PO. Depakine is available in sprinkles if the med has to be given with pudding or applesauce. The common side effects include drowsiness and sedation. Weight gain, tremors, and abdominal cramping can also occur. Hepatotoxicity is a big concern, so it is essential to monitor the client's liver function test. Pancreatitis is possible as well, so we monitor amylase levels too. On another note, this medication does tend to irritate the digestive tract. Although valproic acid is effective in the treatment of absence and complex partial seizures, it is also used to treat the mania associated with bipolar disorder, as well as migraine headaches. There are several drug-drug interactions. Check page 179 of your text for a complete list. And that once again brings us back to benzos, which are also used to treat as adjuncts to seizure treatment. We've discussed mechanism of action and side effects. I just want to make one other point here. Since there is a potential for drug tolerance with this med, dosages will need to be adjusted. Well, that should get you started on meds used to treat anxiety, insomnia, and seizures. Take care.